Good afternoon. This is Chris Vanderveen talking to you live from the Nine News newsroom. We are joined once again by the wonderful, fabulous Dr. Kohli. We're gonna try to make this a regular occurrence in the time when we're sort of dealing with a lot of questions that people have in regards to COVID-19 and its spread. Obviously, a very large development yesterday, a development that we expected, but it is still a development that obviously needs to be reported. 2 presumptive positive cases in the state of Colorado, one in Douglas County, one from a woman living in Douglas County, another a man who had been traveling to Summit County, and both presumptive positive cases. Want to get your thoughts on this. I was just talking to an expert over at University of Colorado about this and what does that tell her. And she said, because I'm starting to ask her, because we have different parts of the state that are being impacted by this, does it tell her anything? And she says, no, because both those people were traveling. And that's the key right now, is that you have a situation where they didn't get it here.
Right. So we have not demonstrated what we call community spread, which means person-to-person transmission here. Both of these individuals contracted the virus out of state, interacting with people who were COVID positive. Now, if our next case turns up to be somebody here who has not traveled outside the state or recently interacted with somebody who's COVID positive outside the state, then we'll call that community spread.
I had asked her, there certainly seems to be an expectation that we're going to get some more cases here.
Many more, yes.
Is the concern when we start to get those cases of, we've seen that in Washington, we've seen that in California, that we get those cases of community spread, because that tells you that it just wasn't acquired somewhere else, but that it was acquired in the community, and therefore there's a concern because it's sort of going around undetected.
I think more so than that, it's really the concern of the potential for rapid spread. So if it's spreading rapidly and easily from person to person, that's when it becomes a pandemic, because the R naught, or the ability of one infected individual to infect others, is 2 to 3. So one person with coronavirus has an ability to infect 2 or 3 others. So you can imagine one individual gets it, they infect 2 or 3 others, and then each of those 2 or 3 infect another 2 or 3. You can get that rapid exponential
That's how you get an
growth.
epidemic. I mean, that's how you get an outbreak.
And that's why we're worried about community spread, because if it's spreading person to person so easily, then that's when it starts to become an issue, as opposed to just having to go somewhere or interact with somebody who's contracted COVID in order to get it.
One of the things that I found is interesting is that we are now getting a lot of phone calls, a lot of emails from people saying, I heard such and such at such and such hospital, and these things, the rumor mill is really sort of starting to ramp up. I suppose that's expected. We saw it earlier in the week. We're seeing even more so now. How do you keep people sort of within reason, protect themselves, but understand that this is small right now in the state of Colorado?
Yeah, I think it is important to separate, fact from myths and information from misinformation, particularly when the situation is so rapidly evolving. And I think if you're ever in doubt, 9 News is a great source of information for what's accurate out there. Your doctor is another great source of information. But don't necessarily believe everything you hear. I just saw something online today that might appeal to you that says if you shave your beard, according to the CDC, you'll have a lower risk of coronavirus.
It's crazy. I mean, just, there's lots of things out there. I think that, let's get to some questions. We don't know much. Carrie West is, what do we know about the Douglas County case as to where they've been? We don't know a whole lot about that Douglas County case.
Well, we do know they went to Vail and Keystone after they
No, this is the Douglas County case.
Oh,
this
Douglas County. Yes.
So there's that other case that sort of the governor sort of sprung on people late at some point in the press conference yesterday. I mean, we want to learn more about the background of that person, where that person's been. We've been told that person traveled outside of the country, was on a cruise ship. That starts to give us some information, and that they're quarantined now, and that's self-quarantined, and that the person is not likely to spread to other people now. I mean, we start going back into somebody's history, do we not, in terms of where you've been?
Well, it's very difficult, but I would say at this point, rather than retracing the entire steps of where they've been, what we need to focus on is how to prevent more cases in the future. Because, there's a finite number of resources, and if you spend a lot of time tracing back the history, then you're not spending those resources to propagate additional new cases or prevent the spread of additional new cases. So it is an important question to ask, but I would say a bigger priority in my mind as a physician is how do we now prevent more cases. And that's advising people about travel, advising people about big gatherings, advising people about hand hygiene, those types of things.
Let's shift gears a little bit. Patty Dennis asked a question, what other pandemics have we experienced? Is there perspective to this? I mean, we learn from those past pandemics, do we not?
Yeah.
And what does it tell us about, what type of pandemics do you look at when you sort of get guidance in terms of what we could experience now?
Well, I think about historically the flu pandemic of 1918, and then we also have the Spanish flu, which was before that. You're talking millions and millions of deaths, you know. And yes, we've had a substantial number of deaths with coronavirus, but we're still at 3,000. Again, we keep talking about the flu, but just compare it to a typical flu season, which is 15,000, you know. And so I think it's important to keep all of those things in mind. Again, the fear that's coming from this virus is the unknown. It's the fact that no one has immunity. It's the fact that we're still exploring what the science tells us. But it's not something we need to panic about because we have gotten through worse before, you know?
And we're learning more. I mean, fortunately, we're learning more information. Here's a very sort of like individual question, but I think it's a question a lot of parents are going to have. My 13-year-old has this is from Vidya and Gary, and I'm sorry I'm going to mess up that name. The doctor didn't want us to bring him in, but they never asked me about his travel history or such things. Should I be concerned?
So you're a very astute patient, and you know the medical system is certainly under a lot of stress at this time with a lot's going on. But yes, in general, the doctor should ask about travel history.
That should become a standard of care now, right? I mean, it's just like we should be asking those questions.
But I would also say as a patient, you have rights. Advocate. If the doctor is hanging up and they haven't asked you, you need to say, hey, wait a minute. I want to talk to you about this, or this, or whatever may be on your mind.
I always say, I mean, we live in an era where doctors are very busy.
Right.
But it is important on the patient to bring up things that they believe are relevant, and don't be shy around your doctor.
No, not at all. In fact, the doctors really appreciate it. I appreciate it because I'm human too. And if I miss something and a patient brings it up to me, it actually feels like we are involved in the decision together and we're on the same team. So
Genesis Sanchez Ortega, I'm wondering if by the end of May or June it's going to be worse. I'm planning on traveling those months. I mean, people are now putting together. We're very close to spring break.
Yeah.
And now people are thinking about what they're going to do over the summer.
Yeah.
We talked about this before, but it bears repeating. Like, what's your advice now when people are sort of thinking about those travel plans?
I would say the who, the why, and the where. So who is traveling? Is it an immunocompromised, elderly, diabetic, cardiovascular disease, hypertension type of patient? Is it a young, healthy person? Why are you traveling? Is it for recreation, as you talk about spring break? Is it for work? Or is it for a combination of the two? And where are you traveling? And I think the answer to those three questions, there's no simple answer as to whether you should or should not travel. There is a risk to traveling, no matter how young or healthy you are, that you will contract this virus, because that is how people have been getting it, is by interacting with each other in closed spaces, which occurs often when you travel. So assuming your risk is low and your benefit of traveling is high, then you can make that decision. But for the most part, if you're elderly or have any chronic medical problems, I would advise at this time to lay low for the next few weeks until we see what the course of this virus is going to do.
This is the time of the broadcast where I remind the people watching, one, thank you for your questions, but two, I'm looking down at my phone.
Yes.
I'm not trying to be rude to you, but I'm trying to get in as many questions as I can to sort of ask. My wife is pregnant. Are there any special precautions we should take?
So pregnant women, we have very little data on. We have a case report of 9 patients who were pregnant who contracted the virus in Wuhan, China. They all seem to have the same risk of getting the virus and the same types of complications as the general adult population. The babies were born healthy, and there doesn't seem to be any evidence of transmission to the baby or transmission in the breast milk. But in general, when you're pregnant, especially if it's early in the pregnancy, we don't have a lot of information about what's going to happen because these results are only based on 9 patients, so very small sample size.
Naomi Lanning, who is at risk with this virus?
The biggest risk, pretty much everyone is at risk of getting the virus, but the biggest risk of complications or life-threatening complications is for those people that are elderly, usually over the age of 65, immunocompromised, meaning their immune system is impaired, have diabetes, heart disease, or lung disease like COPD.
This is an interesting question. Mike Major, have they isolated the strain that is killing people and is genetically different than the strain where people have recovered? I don't think that's true, but you're the doctor, I'm going to ask you that question.
So as far as we know, there's only one strain circulating, and that's the one that has a genetic homology or similarity to the SARS virus, about 75 to 80%. And that's the one that we think may have originated from bats, and it mutated over time and is now able to infect humans. As far as we know, there's no difference in the strain that's causing the difference. It's more the reaction of the host to the virus. So it's not so much what the virus that's infecting me that's different, but it's the way my body reacts to it that's different if I'm young compared to if I'm old.
And it's really dangerous, is my understanding. It's in the lungs. Right?
Yeah,
it's the lungs, and it can lead to pneumonia, and it can lead to that's why people have breathing problems,
right.
correct?
So it leads to an atypical pneumonia. Sometimes you require a breathing tube to help you breathe. And then in the worst cases, the inflammatory response can cause multi-organ failure and shock to occur because of all the inflammation in your body.
Well, here's a question the Colorado ski country wants you to answer. Is there a concern about going to ski resorts since an infected person has traveled there?
So we don't know at this point how long the virus lasts on surfaces, but assuming the surfaces are wiped down very well, there's not any particular higher concern at the ski resort just because there was an infected person there.
I was talking to the person at University of Colorado, Dr. Michelle Barron, right before we got on this, and she said, think of it this way, the optimal place for this virus to live is right here in our noses. This is the perfect condition for the virus to thrive. Outside of that, viruses typically don't love it outside of moist conditions, warmth, and they don't do as well. She said, look, if we wanted to keep a virus alive on a surface for a long period of time, we could do that. But once outside the body, there is not a tendency for viruses to survive. And therefore, because of that, like a ski area 3 days later, after somebody visited, is not going to be swimming in virus.
No, and I don't want people to worry about that because that's very unlikely. But having said that, you touch public surfaces, whether it's the ski lift or you're renting equipment or anything, you be sure to wipe all those things down before you put them on, and that's just regular good habits.
Christina Ramirez, have there been any children that have been affected? I have a 1-year-old and I'm very scared to go anywhere with her.
There have been children in China that have been affected. So out of the 72,000 patients that they studied initially, less than 1% were under the age of 10. So very low rate of infection in children. That's the good news. The other good news is that children that do get infected, so they have a case study, again, of 9 babies that were infected, 7 girls and 2 boys. All of them did remarkably well. None of them required mechanical ventilation or a breathing machine. None of them required ICU stay, and they all recovered pretty uneventfully.
That's what parents want to hear, right?
Yeah.
Because it's certainly, I've got a 9-year-old that,
But wash their hands, because that's the thing with the kids. They put stuff in their mouth.
Good luck with kids. They're like, good luck washing their hands.
You got to do it.
I'm going to do it, though, I swear.
You got to do it.
Once somebody gets the virus and recovers, can they get it again?
And that's an important question. So for the most part, I would say no, but there is a small caveat to that, which is that there is some preliminary data suggesting that there may be some reactivation of the virus without having reactivation of symptoms. So you may actually have, even after you recover from the virus, a week or 2 later, some viral particles present in your lungs without actually having the symptoms again. So scientists are still investigating what this means, if anything, but for the most part, once you get the virus and you recover, you're okay.
It was interesting. I was on the front end of that. I was talking to Dr. Barron, and she said that she reiterated what you said yesterday, that somebody who is asymptomatic, I mean, they're not showing any signs of symptoms, that does not mean they are not shedding the virus.
Right.
Now, it means they could be a lower amount, and they're not sort of swimming in it.
Right.
But it does not mean
that their
there's no
secretions
risk.
don't have virus. Right, exactly. And so the point is that they could be walking around infecting other people without showing symptoms before they become infectious themselves. So again, same things we talked about. Wash your hands, cover your cough, because you just never know.
Jenny asked why it's taking so long to get results from CDPHE on 30 tests. I mean, this is the process. We've documented a lot on this. I know there's frustration out there about these tests. The state has a capacity of around 160 a day. They're not doing anywhere near that, or at least they haven't been. They're starting to test more. I would expect that there's going to be a growth. If we don't start to build up capacity, there's already some frustration now. But now that we know the virus is here, has been here, there's going to be an increased demand for testing. I would imagine you're going to see some of your fellow doctors that are going to get upset about this because they do want to sort of understand what this virus is doing.
Well, and one of the challenges is while you're waiting for the test, you have to treat the person as if they have the coronavirus, as if they're positive. And so they have to quarantine from friends and family and everybody else. So I'm hopeful that they'll develop the blood test soon, which may be a little bit faster than the respiratory secretion test, which we're relying on right now.
Dee Dee, my son has MS and a very weak immune system. We are flying in June. Should we risk it?
I think we'll have to answer that question closer to June because we'll have to know what the viral activity is and where we are in the development. But in general, my instinct is to say weakened immune system, probably not a good idea to do non-essential travel.
I love this question from Chad because it really sort of brings out a question that I've had: cold versus COVID. How do you know the difference with the disease that seems like, with cold? Cold, flu, COVID. What's the difference?
Important question. So let's talk about it a little bit. So colds tend to live neck up. So think of it it infects mostly your neck up. So you have a stuffy nose, you may have a sore throat, you may have, irritation in your eyes, you may have a headache, you have muscle aches and pains. COVID is your chest, is your lungs, because it's a respiratory infection that infects your lungs. So think about shortness of breath and cough as the two major mainstays. And then, of course, fever. Fever is a systemic sign that we can see with everything: cold, flu, and virus. And then the flu is you maybe have a sore throat, you maybe have a dry cough, but it's primarily the muscle aches and pains that are the leading symptom in flu. But my point is they all overlap. Because the fever, the muscle aches, the fatigue, and the headaches, they're kind of there in all of them.
Every time I get sick, I get those symptoms. Every single time. And I'm like, do I? Look, we know that the risk remains low.
Yeah.
Even in Colorado. This is not the chances are the person sick next to you on the bus or the light rail.
Right.
It may be annoying.
Yeah.
But the chances are not good that person has COVID, right?
Not at this point, but it could be in a few weeks. We could be having a different discussion.
But that's important. At this point right now,
today,
because I sort of envision a scenario where people. I said this for a couple weeks now. Like our tolerance of people next to us, of them coughing and sneezing, is going to go down very, very quickly.
Yes.
But again, the chances. It's not like this virus is everywhere right now in Colorado.
Right.
Let's have some common sense here. But at the same time,
Yeah.
You're around somebody like that, wash your hands. Do the things that we've been telling you about for a number of days, right?
Well, and you could cover your face too or turn away. If somebody's actively coughing,
Excuse me.
You just want to make sure you protect yourself because when they cough, they aerosolize those small droplets from their lungs out. And you're right, most likely it doesn't have COVID in it, but that's the way that it's spread. But to answer your original question, fever and cough are the two big ones. So if you have those two symptoms, even if you haven't traveled, it is a good idea to call your doctor.
I knew, Caroline, I knew someone was going to call me out for touching my face because I can't stop doing it, so you're totally valid in pointing that out. The news has said that the flu is actually worse. If so, why aren't we quarantining people who have the flu? We're getting mixed messages. If the virus lives well in nasal passages, then why are we being told not to wear masks? Again, mixed messages.
So I'll answer the first question first, which is that why aren't we quarantining people with the flu? Because the flu's been around a long time. So many of us have immunity to it, and there's a vaccine. So many of us are protected against it. There's also an antiviral. With this virus, it's got a higher mortality than the flu, meaning it kills a higher number of people. It's got a higher rate of complications than the flu. It's more infectious because one person can infect more people, and none of us have immunity because it's a brand new virus. So that is the reason that we're being more cautious with the spread of this virus. Now, 2 years down the line, if this virus is still around, it could become like the flu, where we have a vaccine and we have something we have to deal with every year, and it's a community virus, what we call. But at this point, because it's brand new and people are susceptible, it's killing people, and we don't have immunity, that's why we're concerned.
Working on a story today about lots of people are working on a vaccine around the country. There's some people up at CSU that are working on a potential vaccine. it's a long process. It doesn't like you don't just snap your fingers and come up with a vaccine.
Usually about 2 years, 2 to 3 years.
It's going to take a long. There's the hope that if they can
Expedite it.
yeah, whatever the word is. It's been a long week.
Yeah.
If we can expedite the process, then we maybe get it down to a year or something like that. But like this is not something that we're 2 months away from in all likelihood of like a
I
mass
seriously
production
doubt
of
it.
vaccine.
Although there are 3 or 4 companies that are already, have developed the vaccines, and they're going to enter clinical trials in the next few weeks, as far as we know. I want to answer the mask question real quick, which is that yes, even though it does mostly live in the respiratory passages, masks are not an effective way to filter the small droplets. So think about big droplets and small droplets. It's like that movie scene when somebody sneezes and you see they're the big ones that fall close to the person, but then there are the small ones that can travel up to 6 feet. And the masks just cannot filter those because they're loose fitting. They don't form a seal around your mouth and nose, and so they can't keep those out.
Do you find yourself getting more and more paranoid?
No, I don't think so. I mean, the way I'm looking at all of this is sort of like we were in dress rehearsal all this time, and now it's showtime. So we've been preparing and getting ready, and now it's the night of the show, and we got to perform.
I'm seeing some questions about asthma patients, cystic fibrosis patients, people with autoimmune diseases. All of these are potential
Very high risk, especially cystic fibrosis and autoimmune diseases if you're on immunosuppressants. Absolutely. Very high risk.
And just this is where you sort of take your own health and safety a little bit into your own hands and do what you believe is smart, but avoiding large crowds, being on airplanes, maybe not a great idea right now.
Not a great idea going to concerts or crowded places. I mean, you even want to think about things like, going out to eat at a crowded time, things like that. Just anywhere where you would be in close contact with a large number of people with the potential to get an infection.
I hope we're getting the audio out there. I'm getting a couple of comments that the audio might be a little low, so we might cut this a little bit short.
Okay.
Cruises to Mexico. I mean, a lot of these are a lot of, well, I do want to address this. It's not like the virus is everywhere. We have to only talk about how we're not even hitting the daily capacity of tests. I think, look, we've been critical of the ability of the state to test a lot of patients, but there have been some tests, and there is nothing right now to indicate that it's everywhere. Right? There's nothing. We've been testing enough to get a general idea of what's going on. Could we be testing more? Absolutely. Should we be testing more? Absolutely. But I think there's nothing right now to indicate.
Well, and I would say, I mean, the majority of people have symptoms. They might be mild symptoms, but they do have symptoms. So the fact that people are not having symptoms is kind of a good indication that they probably don't have the virus. It's a very small percentage that are completely asymptomatic for the entire duration of the illness. And it's case reportable, actually. So to your point, if it was here and it was everywhere, more of us would be having symptoms.
Thank you, Jeannie. I could talk to you all day. I hope you're meaning us, and hopefully not somebody else. Thank you for your support. The WHO still thinks this can be pushed back. Do you think we have a chance at containment?
Yeah, so 2 responses to an epidemic. Usually they're containment, which means trying to eradicate and contain the virus, or mitigation, which means it's gotten out, we do the best. In my opinion, at this point, containment will be challenging. Now, as the weather warms up, it's possible viral activity could go down, but given the magnitude of the number of cases we've had, containment may be difficult.
I'm going to wrap it up now, but I want to reiterate something that I heard from a hospital yesterday, and I'd be curious your opinion on this. Well, hospitals are now urging people, if you have symptoms and you want to get tested, don't just show up at a facility.
Right.
They're saying, like, particularly emergency rooms, you don't. It is not good advice to just simply show up at an ER right now with symptoms, because not only are you putting staff at risk, but they're also not going to be in a position to treat you how they want to treat you at that facility. And you run the risk, if you do have it and you didn't give that warning, that heads up to the facility, you're putting people at that facility at risk. So they're saying, just give us a call.
Right.
Let us know you're on your way, and we can tailor our response to you accordingly. And I think that's critical. I mean, it sounds sort of obvious, but at the same time, it's not something we typically think of, like giving the ER a heads up, like, hey, I'm heading over there. But I think that's really valuable.
It's really valuable. And the other thing I would add is, if you think you have coronavirus or COVID-19, that's when you put a mask on. We talk a lot about masks, but if you think you have it, you put a mask on until you end up talking to your healthcare provider, because that has been effective to reduce the spread to others.
We've gotten a ton of questions, and I can't thank you all enough. We're gonna try to do this on a regular basis. We're trying to see around 12:30 during the weekday when you're here, and we're not taxing you too much. But thank you so much, Dr. Kohli.
Thank you.
And thank you everyone for joining us.
And thanks for your questions.
Yeah, the questions are great.
Yeah.
These are really great questions, really super informed questions. And hopefully we've been able to answer a few of them. And again, we're going to try to keep this up on a regular basis so you can join us again. We're shooting for 12:30. We're going to kind of see if we can get us a more regular time during the weekday. But right now, this is what we got. And thank you so much for joining us. And thank you, Dr. Kohli.
Thank you.
Bye.